Hi, welcome back to my channel. My name is Edith Ndoka and I remain your dynamic nurse. So in today's video, I am going to be discussing the different kinds of vaginal discharges and what each of them signifies. Okay, keep your eye glued on this channel. Make sure you watch from the beginning to the end because you are definitely going to learn something new today. Number one is frothy yellowish green vaginal discharge. This kind of discharge is caused by an infection known as trichomoniasis. And this trichomoniasis is being caused by a protozoa known as Trichomonas vaginalis. This is a sexually transmitted infection, meaning you only get this infection when you have an unprotected sex with an infected partner. 50% of women who have this infection are asymptomatic, meaning they don't have any symptom, they don't even feel it. Okay, but the common signs and symptoms includes the yellowish greenish vaginal discharge, which is very offensive and has fishy smell. You can have some itching, some stinging in the vagina region, and also you can also experience dyspareunia, maybe painful intercourse, like when you have pain when you're having sex with your partner. Okay, so this infection, the good news is that it is totally treatable. So it is being treated with antibiotics. So if you notice any of these signs and symptoms, especially the discharge, please go to your doctor and seek for advice. And remember, if you're being on treatment for this infection, you have to abstain from sex for at least 1 week while you're during the course of the antibiotics, and make sure that your partner is also treated as a carrier, especially people that you have come in contact with sexually for the past 2 weeks. You have to make sure that all of them get treated for this infection. The second type of discharge is thick yellowish discharge. This thick yellowish discharge is being caused by an infection known as gonorrhea. And gonorrhea is being transmitted by an organism known as Neisseria gonorrhea or gonococcus. Gonorrhea is a sexually transmitted infection, meaning you can only get gonorrhea through through having unprotected sex with an infected partner, or by sharing sexual toys. You know, when somebody is using vibrator and maybe they didn't wash it, they didn't sanitize it, and it passes it to another person and they use it, and if the person has the infection, it's going to definitely be transferred or transmitted to the next person. Gonorrhea, about 80% of women infected with gonorrhea are asymptomatic. It is more symptomatic in men than women. So when a woman have the gonorrhea, the only way she can know is by having these signs and symptoms. Number one is this yellowish discharge, which is very offensive and smelly. Okay, and the person might be having postcoital bleeding, like bleeding after sex. The person might be having intermenstrual bleeding, so you have some bleeding in between your menses, and also painful urination. The person might be having some stinging, some abdominal and pelvic pain as well. The thing is, gonorrhea is very dangerous because number one is it is asymptomatic. Many women don't know until it causes more harm to them before they find out. And secondly, gonorrhea can be transmitted to an unborn child. So if a pregnant woman has gonorrhea, it can actually cross the placenta and be transmitted to the baby. And the bad thing is that it can cause blindness to that unborn child. So if you are a pregnant woman and you notice any of these signs and symptoms, please run to your doctor and make sure And most of the babies whose mother had gonorrhea during pregnancy, they have been treated with antibiotics as soon as they have been born. Okay, so the treatment, the good news is that gonorrhea can be treated. Yes, it can be treated with some antibiotics. Okay, and also remember, when you're being treated for a sexually transmitted infection, make sure you also treat your partner at the same time and avoid sexual intercourse throughout the course of the treatment. The next discharge is red or pinkish vaginal discharge. So this red or pinkish vaginal discharge can be normal and also abnormal. So it is normal if you are expecting your period. Okay, so most times you have like a reddish or pinkish spot, and then the next day your period comes out. It can also be normal if your period is a bit delayed and probably you're trying to get pregnant. Go and have a pregnancy test, okay, to confirm. It can also be normal most times after sex due to friction. The lady might experience some postcoital bleeding, like having that pinkish or reddish spot. But on the other hand, this can also be a sign of an abnormal vaginal discharge if a woman is pregnant, still in her early pregnancy, and experiences this reddish or pinkish discharge. You might have to go to your doctor to have a good look to make sure that the pregnancy is safe. Okay, it could be a sign of an early miscarriage. Also, this kind of bleeding can be abnormal during the menopausal period, especially if a woman has entered in her menopause, over a year, have not seen her period, and all of a sudden started experiencing this reddish or pinkish vaginal bleeding. This could be a sign of endometrial cancer. You might want to go and see your doctor and have some investigation done just to make sure that everything is okay. All right, so this red and pinkish discharges is not usually as a result of infection, so you don't need any treatment. You just need to go and find out while you are having that discharge. The next type of vaginal discharge is creamy, can be plumpy, thick, creamy, or white discharge. Okay, this discharge usually look like a cottage cheese. It is caused by an infection known as thrush, and this thrush is caused by a fungi known as candida. The good thing is thrush is not a sexually transmitted infection, but it can be triggered by sex. Okay, so how? You know that normally the pH of the vagina or the vaginal discharge is acidic, and the sperm is slightly or more on the alkaline side. So when one has an unprotected sex and the sperm is deposited in the vagina, it neutralizes, it alters the normal pH of the vagina. So any activities that can alter the normal pH of the vagina environment can predispose the individual to developing thrush. Another thing is douching. Douching simply means using all these scented products or vaginal products to wash the vagina rather than just clean water. So these douching products usually alter the normal pH of the vagina, thereby predisposing the individual to having infections. Okay, because when normally, as the vagina is very acidic, it helps the bacteria, the lactobacilli, to be able to fight other bacteria coming in to fight infections. But when this is altered, it can predispose the individual to developing infection. So the signs of this thrush could be stinging or having itching in the vagina area, or also slight redness in the vagina region. And the good news is it is also treatable. But most of the time, thrush goes away on its own with good personal hygiene without even taking any medication. But most of the time, it is being treated by antifungal medication. So if you're having any of these symptoms, please visit your doctor and you might have some medication administered to you. The next type of vaginal discharge is the grayish colored vaginal discharge. This gray colored vaginal discharge is caused by bacteria vaginosis. It is not a sexually transmitted infection just like thrush, but it can be triggered by sexual activities. So any activity that can alter the pH of the vagina can also predispose the individual to developing this bacterial vaginosis. But the difference between bacterial vaginosis and thrush is that bacterial vaginosis has an offensive, fishy odor. Okay, but the thrush doesn't have all those kind of offensive odor. And this bacterial vaginosis, like I said, can be caused by anything that can alter the activities or the pH of the vaginal discharge, just like unprotected sex, having multiple sexual partners, unprotected sex with multiple sexual partners, also douching, which can, change the pH of the vaginal discharge. And the treatment for this bacterial vaginosis is with the use of antibiotics. So you remember, for thrush you use antifungal, but this is antibiotics. And because it is not a sexually transmitted infection, your partner doesn't need any treatment, unless if they're having the symptoms of bacterial vaginosis, then they can also be treated. But other than that, they don't need treatment. The last type of vaginal discharge is a clear, odorless vaginal discharge. This is the very normal vaginal discharge. Okay, it does not have any smell, and the consistency varies depending on the stage you are in your cycle. Okay, it is usually more during ovulation. So during ovulation we tend to have like more discharges. It is also usually more inconsistency during sexual arousal. So when you're having the foreplay during the sex, so you tend to have more discharge and get more weight, and also during breastfeeding. So this type of vaginal discharge does not cause any symptom at all. No itching, nothing, not smelly. It is just normal. Thank you for watching, and I hope you learned something new from this video. Please, if you like this video, don't forget to hit the subscription button and also click on the like button, because it helps me to get more visibility, please. And also don't forget to click the notification bell, so that when I post my next video, you will be among the first people to watch it. So continue keeping your eye glued on this channel for more educative and entertaining videos. Thank you for watching. Bye.